This is Equality and Justice Now, sponsored by Pennsylvania Now. My guest is Carol Tracy. She is the Executive Director of the Women's Law Project. It is a nonprofit legal advocacy organization dedicated to promoting and protecting the status of women and girls in Pennsylvania. Welcome, Carol.
Thank you. I'm glad to be here, Karen.
Now, Women's Law Project published a study called Through the Lens of Equality, and that was basically the impetus for the Pennsylvania Agenda for Women's Health. Can you tell us about this agenda? What is the Agenda for Women's Health?
Well, the Agenda for Women's Health is a package of bills from a pro-choice, bicameral group of legislators who are part of the Women's Health Caucus in Pennsylvania. And the Women's Health Caucus is a pro-choice caucus, and that's really important for us to recognize. The Pennsylvania Agenda for Women's Health really is a series of bills that's looking at a broad range of issues that are affecting women's health. You mentioned Through the Lens of Equality. When everything was going on around the Affordable Care Act, the Women's Law Project thought we ought to be looking at this because issues of law and health intersect so much. So we began to do a study from the point of view of how equality impacts health. And for the many years, you know, the Women's Law Project's now almost 42 years old. For the many years that we've been working, we've known that health and law were connected, particularly because we do so much reproductive health work. But we were shocked when we found some of the data, both Pennsylvania and nationally, that showed how there were such strong correlations between women's legal status and their health status. For example, in issues of sexual and domestic violence, of course we know that there are significant injuries that are associated with that. But we didn't know that there were a lot of other manifestations of diseases like cardiovascular diseases, gastrointestinal diseases, that also accompany it. Now, you know, when you think it through, that's not a surprise.
Right.
It makes perfect sense, the stress and the trauma that's associated with that. We've also seen that in some places, there's some research that has shown discrimination in employment has tremendously adverse health effects on women. Again, some of the trauma is, in some cases, at least the one study showed us, that it was similar to being raped, being mistreated on the job. We know that women also have a tremendous amount of strain connected to caregiving responsibilities. And some of those issues really shocked us. My goodness, women who are caring both for their elderly parents and their children suffer enormous health consequences. And of course, the worst of course, are women who live in poverty. Women who live in poverty, you know, from heart disease and diabetes, strokes, obesity. And throughout all of these, we see a lot of trauma. We see a lot of issues connected to the issues of sexual assault and domestic violence that, frankly, are so widespread in our society, just permeate in lifetime consequences. And some of those issues really shocked us. I mean, in fact, everything we found shocked us, and we thought we probably knew more than most people because this is the work we do.
We've been looking at it for a long time.
So we looked, when we started looking at this, it was partly because there was so much discussion about healthcare, but all of the national studies that are done on women's health and well-being in Pennsylvania always have us with very, very low ratings. You know, a 2010 study showed that we were 44th in the nation for death from breast cancer, for example. So high numbers like that with cardiovascular disease, gastrointestinal disease, as well as issues connected with trauma and depression. So, and a new study just came out by the Institute for Women's Policy Research that showed the same thing.
So Pennsylvania just hasn't been doing very well for women in terms of their health at all.
No, not at all. And we know in the 2011 legislative session, a third of their legislative days were devoted to figuring out how to restrict an essential element of women's health, which is access to abortion care. So while the Pennsylvania legislature has been obsessed with restricting access to this essential portion of women's health care, access to abortion, they also have completely neglected and paid no attention to the rest of the health care issues that women face. So we published Through the Lens of Equality in 2012, and in it, of course, after we described these horrific data, we also knew we needed to make some policy recommendations, so we made a series of recommendations for what Pennsylvania should do. In
other words, you sort of took a look at women's health, not just women's access to abortion, but women's health, right, and sort of followed where it led you.
And you know, as lawyers, everything that's in this publication has the citations. It's based on evidence-based research, and in many respects, it's also shocking to us that it took lawyers to put this together. You know, I would be hoping that more healthcare professionals would be more engaged in this, but they may not make the connection between equality and health, and that's what we're trying to do.
I think that's really what it does come down to, is you took more of a broad view. But so tell me,
And shortly after we published it, our staff attorney in Pittsburgh, Sue Fritchie, got a call from Representative Dan Frankel of Allegheny County, and he said, you know, we want to reinvigorate the Women's Health Caucus. And the Women's Health Caucus is by its nature pro-choice, and in the Pennsylvania legislature, that's a big deal.
Right. Got a job.
And yeah, and he said, but do you have any ideas for a legislative agenda? And we said, oh, do we ever? But I think in a couple of hours, we sent him 26. And that was really the beginning of the Women's Health Agenda. There's one other area that I didn't mention that I think is so essential, though, and that's around reproductive health, because, you know, we are so focused on abortion, which of course is essential, but what we haven't paid attention to nearly enough to are the needs of pregnant women. And, you know, one of the important bills in this is the Pregnant Workers Fairness Act. We also, while we were writing this, for some reason, we were also getting an uptick in the numbers of pregnant women who were calling us who were losing their jobs because they were pregnant. And we've had the Pregnancy Discrimination Act for 36 years, and it took a lot to pass that. But it turns out that there are a lot of gaps in the law. And I think the Pregnant Workers Fairness Act is a centerpiece of the Pennsylvania Agenda for Women's Health, because I think in many respects it also shows the hypocrisy of the legislature, because even though it was introduced last year, we still haven't passed it.
Right.
This is something that should have been passed immediately. Right. And of course there's a similar federal bill pending that hasn't passed either. So what I like about the Pennsylvania Agenda for Women's Health is that it's a broad range of women's rights and women's health issues. Clearly, women's economic status is very connected to their health. So we're not just looking at economic issues, we're looking at health issues, we're looking at issues connected with domestic and sexual violence. We're looking at poverty issues. We're trying not to silo the women into just
reproductive rights, right?
Yes,
women's issues. How about people issues?
Yes, sexual assault and domestic violence over there, and you know, and poor women. I mean, so many times people talk about poverty as though there's no gender associated with it, you know? So I think that we had the ideas, but of course, it's the Pennsylvania legislature that really took off in understanding that these issues are intersectional issues. Mm-hmm. And so we've had 3 sets of bills that have been introduced. And you know, it's really great. More and more people are wanting to sponsor the bills, and it's getting lots of national attention.
I'm speaking with Carol Tracy, Executive Director of Women's Law Project, and you're watching Equality and Justice Now. So this is the second year of the Pennsylvania Agenda for Women's Health, and 3 bills were actually passed in the last session. Can you talk about that?
Yes, and that was very, very exciting because, you know, it's a conservative legislature. So, and I also want to say that though we made recommendations, a lot of the legislators came forward with their own recommendations too. So it's not that this all came from us. I think we were the genesis of it and still have many more ideas.
Oh, sure, sure.
The legislators are stepping forward, and one was what we commonly call revenge porn, where sometimes photographs of individuals that they consented to have been used and put up on the internet and without the permission of the person. So that was very exciting. I think one of the most exciting bills was a bill connected with nuisance laws for domestic violence victims. There were some areas, some municipalities, that if a person called the police too much,
yeah,
they could be charged with a nuisance.
Yeah, you're getting beat up and it's annoying too.
And absolutely. So not only did we pass that bill, but there were efforts made to hijack that bill.
I know one of them was they tried to put a gun, pass a law that municipalities could not come up with their own gun laws. I mean, how does that belong in that bill?
And what was wonderful about this is the domestic violence community held firm, because the other issue that they tried to hijack it with was paid leave. So and I think that not only are the legislators coming together, but our broad women's rights community is coming together. So working with Pennsylvania Coalition Against Domestic Violence, with Pennsylvania Coalition Against Rape, with legal services organizations, with NOW, with Women's Way. It's just wonderful. And of course with Planned Parenthood and the ACLU. I mean, right after we started talking about this, among the first people that Sue Fritchie contacted were Sari Stevens at Planned Parenthood Advocates and Andy Hoover at the ACLU, because they're in Harrisburg all the time. Mm-hmm. And you know, we know this is a big mountain, but we've really, it's a game changer.
Absolutely.
We have changed the conversation, and not only have we changed the conversation in Harrisburg, national people are paying great attention to this. It's like, yeah, let's be proactive.
Right.
Let's stop being on the defensive, and mind you, there's still a lot of defense work that we need to do, and we're working on that in Pennsylvania. So we're not gonna step away from the bad stuff that's there. And we've formed a campaign because this is like a political campaign.
Absolutely.
We have the legislators with the Pennsylvania Agenda for Women's Health, and all of the advocates are working in the campaign for women's health. And we really see women's health in the broadest context. And you know, one of the other things that I think has been important as the bills have been introduced is to know that there's something that is pro-choice in all of these introductions, because we want to normalize abortion rights.
Right.
We want to.
It's part of a continuum of health care for women.
Absolutely. And this whole women's health agenda is a continuum of women's health. Economic security, being free from physical and sexual violence, having access to appropriate reproductive health care. We've got to do something about the unconscionably high infant mortality and maternal mortality rates in Pennsylvania. We have to do that. And the only way we're going to do that is if we keep talking about it and we keep hammering it. And that's, I think, what both our legislators are doing and our community of advocates are doing.
I think you're right. I think we are definitely well begun. Let me, I want to talk about the latest round of bills that have been introduced for the 2015-2016 session. Now, these bills have been introduced under the umbrella of the Agenda for Women's Health. They include bills to make a more family-friendly workplace, such as workplace accommodations for pregnant women or sanitary conditions for nursing mothers. Bills aimed at economic fairness, such as raising the minimum wage and fixing the Pay Equity Act, which certainly has not accomplished its purpose of closing the gender wage gap in Pennsylvania. Bills focused on supporting healthy lives for women and families, such as studying the health needs of our women veterans, protecting the integrity of the doctor-patient relationship, and ensuring safe access to healthcare facilities. And then other bills that focus on domestic violence and sexual assault awareness, such as extending sexual harassment protections to all Pennsylvania employees, and the Safe Campus legislation. Now, so I know that that's a whole lot of bills, which obviously is a comprehensive approach towards women's health. That is the point. But I'd like to specifically talk to you about the sexual assault bill on campus, because I know that you have a deep background in the issue. Can you explain how Title IX relates to campus sexual assault and how this bill will help?
Yes, well, Title IX is it's a federal bill that prohibits discrimination in educational institutions. And most people connect it with athletics, but frankly, when it was first enacted, women were discriminated in higher education quite regularly. One or two women would be admitted to law schools or medical schools, and so Title IX just completely wiped that out and changed it immensely, so people don't even think of that anymore. Right. And in many of these issues, I think it's really important to know we had major reform 40, 50 years ago, and what we're looking at now in many respects is either the lack of implementation or the gaps that we've learned that exist in the laws. So Title IX prohibits discrimination on the basis of sex, and sexual harassment is a form of sex discrimination, and sexual assault is the most egregious form of sexual harassment. Title IX is a civil rights law. It's different from the Crimes Code. And this is one of the things that I think has been very confusing to many people. And many of the critics of enforcement of Title IX keep using a criminal justice lens to look at this. People who bring complaints against their academic institutions, if they're doing it just through Title IX, the penalties aren't jail.
Right.
The penalties may be suspension, could be expulsion, could be other kinds of remedies. It's a civil rights law. And I think that comprehending that rape is also a civil rights violation is very, very difficult for people. Now, one of the other issues, when one is in the criminal justice system,
it's really not a leap for me, frankly.
Right.
I mean,
but it's that's right.
But
how could it
women's,
be a leap?
yeah, advocates.
Sexual rape has plagued women for centuries, forever possibly. So the criminal justice standards are very high because the criminal justice system has the power to take away someone's liberty, has the power to take away someone's rights to freedom. They can jail a person. So the standard of proof is very high. It has to be beyond a reasonable doubt. Right. And that's a very, very high standard, and it's appropriate in the criminal justice system. In Title IX and in other civil rights remedies, one has a preponderance of evidence. And that's been an issue that has been debated widely now, that it's not fair, that we should be using the criminal justice standards in looking at campus sexual assault. And we shouldn't be. When we're looking at beyond a reasonable doubt, the question is, who of the people that you have talked to is far more likely to be telling the truth than the other, or who is far more likely to be lying? Title IX standards employ a standard of both people come to the proceeding equally. It's an equality. It's a civil rights law. So now, schools have known about this. I mean, I I led a sit-in at the University of Pennsylvania in 1973, protesting rape on campus. This is not a new issue.
This is not new at all.
And then when I was the director of the Women's Center in 1982, I led an effort connected to a fraternity gang rape that the institution didn't respond to. And it's been typical for years and years and years. Schools have simply turned a blind eye to this issue. And they've known what their legal obligations are. In 2011, the Department of Education Office for Civil Rights issued what's called a Dear Colleague letter that laid out for the schools their existing obligations. This was not the first time that they issued a Dear Colleague letter. In fact, it was the third time. And they needed to clarify in that what the schools were supposed to do and their requirements to report sexual assault. They recognized that sexual assault immediately constitutes a hostile environment, and that the schools had to have programs in place to prevent it, to intervene, and to remedy it. And the schools came under investigation. At the same time, a couple of young women who are featured in a new documentary called The Hunting Ground from University of North Carolina, Annie Clark and Andrea Pinto, discovered Title IX as undergraduates. And they filed a complaint. And then with the amazing sources of or resources that are connected with social media, they connected with women students all over the country, and they started a revolution.
Yes.
So we have a very strong Department of Education in the Obama administration that's really enforcing this, and we have student activists who have said, I am entitled—
Enough is enough.
Yes, I am entitled to have an education free from sexual assault and sexual harassment. And to me, it's a new movement. I think they are demanding equality over their bodies. They're demanding sovereignty over their bodies in ways that it's never happened before. I mean, rape has been so stigmatized. Rape and abortion are both issues that have been so stigmatized. And when you hear issues about legitimate rape in the abortion context,
yes.
You see how these issues come together. And both of these issues have been used to control and oppress women. Women have been ashamed. I mean, the reason that reporters don't use the names of women in newspapers, it's not a feminist issue.
No.
It's the shame that it brought to families. So now we have young women from Ivy League prestigious universities that are using their names, showing their faces, raising their voices. And that, to me, is the beginning of a very new women's rights movement. And we're around, I think, those of us who were around 40 years ago, I hope to help support that and
Absolutely.
build it. And I think it will manifest itself well beyond colleges and universities.
I think you're right. I think it's well on its way. Let me just ask you about the bill that's the campus sexual assault bill that's in the Agenda for Women's Health.
It's a bill connected to reporting, so that the schools provide more information about the incidents of sexual assault and domestic violence. It includes domestic violence. It's not just sexual assault, because unfortunately, we're finding a lot of physical abuse in dating situations or acquaintance situations. That's also very alarming. And the Clery Act requires that schools have policies about it. It doesn't have the Title IX implications, at least it doesn't at this point, that sexual assault does. But schools are also required to have these policies around stalking and domestic violence. And I think it's dating violence, people call it. I mean,
and doing that kind of reporting will definitely should help to, focus on the issue and hopefully eradicate it a little.
Shed the light on it. I mean, transparency is critical in any of these kinds of issues.
Right, of course. Well, thank you very much for coming and talking to us. My guest has been Carol Tracy, Executive Director of the Women's Law Project. The Pennsylvania Agenda for Women's Health is an exciting new initiative undertaken by the Women's Health Caucus in the Pennsylvania General Assembly. The campaign is supported by advocacy groups statewide and people like you who care about the status of women and girls. Find out more about the Campaign for Women's Health online at paforwomenshealth.org. Find out more about Pennsylvania Now online at pennsylvanianow.org. You've been watching Equality and Justice Now on PhillyCam. Thanks for watching.